what I do believe is that, and we need to transition forward, and some physicians embrace this and some don't. We have to look at other levels of healthcare professionals, nurse practitioners, and advanced practice nurses and folks like that. We're just not going to have enough physicians. And those advanced practice nurses and other levels of healthcare workers can indeed take some of that off.
You mentioned that like 11% loss in Medicare patients. Is that for your hospital in particular? Is that like a nationwide average?
I took what I was describing was Missouri. The average hospital in Missouri loses about 11% on Medicare. Ours is somewhere, actually ours is somewhere a little bit higher than that.
And can you talk about the difference in medical costs between different hospitals? Because I know for services there's a wide range of what people are charged and what's paid out.
Yeah, the individual hospitals have different charge structures. You know, sometimes bigger hospitals than my hospital do different things that require, I guess, are more esoteric in nature, and so they have some additional costs that they have been able to convince insurance companies that, for example, St. Luke's would say, we take care of these kinds of patients, and we really ought to get paid more than Liberty Hospital. And that's understandable to an extent, but it's really hard to, you know, they make a judgment call as to how much they're going to pay for that. What we charge is really antiquated as how we go about doing it. We're paying attention to, okay, we've had to cut this discount with these different insurance companies. And so to make up for that, we raise the prices. So if we're going to get paid 35% of something, we're going to put the number higher so that it comes closer to giving us a bottom line. Now, do hospitals make a lot of money? Honestly, we run on a pretty razor-thin margin, quite frankly, right now. There have been years in the past when we've had a better margin, but right now, with the amount of care that we're giving away, and I think we honestly are better off than places like St. Luke's and others. And so our bottom line is you know, a couple percent, and you can compare that to, I guess, grocery stores are somewhere around 1%. We run on a pretty thin margin, and we have a $275 million annual revenue in our place. So a couple percent does give us $3 or $4 million. But when you think about spending $10 to $12 million a year on equipment alone, just new replacement equipment, when you think about paying 50%, somewhere around 50% of our costs are in salaries, and our trying to staff a hospital, honestly, is not all that easy. Our hospital, Monday morning, we have 160 patients in house. By Tuesday night, we had 220. You know, that kind of swing is pretty significant. And so having enough staff, you've got full-time staff and then you've got a lot of part-time staff. But even at that, when you jump by almost 50% increase in your patient census in a 36-hour period of time, you're running short.
Go ahead, Rob.
We've been told that the Senate bill has taken out the public option. Today I heard that supposedly somebody that's read this whole thing said that they found something somewhere in there that said a government agency, and I can't remember the name of it, but by letters it was like IMO or something like that, had the authority to fix you up with insurance if you couldn't afford it. And so they're saying, in fact, that, hey, the public option is not gone. It's still there. It's just hidden in a different place in a different way. Have you heard about this?
I honestly have not. People who have read the bill tell me that it was gone, but again, I haven't tried to read through with a fine-tooth comb. So if that's the case, I believe through this process, I believe it will be enough smart people will be going through that with a fine-tooth comb to make sure that at least we know about it if we're going to pass it.
Hopefully.
Hopefully.
Another quick question. If this goes through and you make a lot of changes and actually pay less for services, is this gonna cause us a problem with physician and healthcare people leaving the industry? As apparently it has in some other countries.
I believe that it will. If, you know, as many of you know, okay, a physician comes out of medical school, not a few of them have in excess of $200,000 in education loans that they have to pay for. And so over some period of time, they need to be able to make enough money to pay that off. Now, you know, and it depends on, and here's another problem, is that we really pay the specialists really well, and we don't pay those primary care physicians, which I've been touting as important for preventative care. And so you've got primary care physicians making $120,000, $130,000, which is not bad. But if they've got a couple $100,000 of loans that they owe, it's going to take a while. On the other hand, you've got cardiologists going to subspecialty in cardiology, $400,000, $500,000, $600,000 a year that they can make. Maybe not in the first year, but as they build into their career, they can do okay.
Question, Joe, behind you. And in some ways, this dovetails a little bit with what Rod just asked and some of the other things you said. This isn't a fair question for you to answer. Please just say that you as you talked, you kind of gave us a little bit of a day in the life of Liberty Hospital a little bit. In the event a bill in some form passes, how do you see that changing that very same scenario that you just described? What kind of, I mean, there's doctor availability, you kind of addressed a little bit. If you could add to that or elaborate a little bit, that'd be great.
I think it's going to be really fairly slow as far as the change is going to occur. If you look at where in the bill, or in the Senate bill, the amount of money that they take away from the healthcare industry, the amount of money that they're reducing paying to physicians and hospitals, and the amount of money that they're levying in taxes, because there's some taxes in here, talking about.
Oh, no, there's no tax.
There's some taxes in here. And then how much, and then over this column, how much they're going to spend on that in the first 4 or 5 years. Between 2010 and 2014, additional changes in how they're going to spend money are not going to happen. There isn't going to be very much in the way of spending, but they are going to take in the taxes and the cuts. They're going to put them in the pot. I was with a group that we talked the other night. They're going to put this in a pot over here, and they're sure going to save it to pay off something else.
Yeah, right.
But it's going to kind of come slowly, and unless something unusual happens, I believe it'll pass. Now,
Hope next Tuesday.
and when they pass it, they will be fun. They will not be finished. It will get changed. There will be regulations that will be written. There will be additional legislation, and to an extent, in healthcare, I feel like it'll be death by 1,000 cuts over a period of time. Now, what's it going to mean to us right away? I think we will begin to see some diminishment of the ability to recruit physicians to our staff. I think that we will, again, see erode any margins that we have. We will begin to, we as hospitals will survive, but we will cut back on the number of nurses on the floor, and that the care will be impacted by the fact that we can't afford to pay, have the same nurse-patient ratio that we have right now. So I don't think that it will be a real stark change that you'll see. It'll be a gradual sliding down the hill.